So there are really two main GLP-1s on the market, semaglutide, which is Ozempic and Wegovy, and tirzepatide, which is Mounjaro and Zepbound. I will say in head-to-head trials, tirzepatide almost always wins. It wins as far as ease of weight loss, it wins as far as total body weight that you can lose, and it certainly wins as far as the side effect profiles go. So most people are less nauseous with tirzepatide than with semaglutide. That said, it has to be a really patient centered, individualized decision between you and your provider because no two patients are the same, and the recommendation is certainly not always the same. I will say that some insurances prefer or only cover one versus the other. So that's certainly something to take into account, especially if we're looking at getting medication approved through insurance and paid for through insurance. The other thing to think about is cost, right? Not Semaglutide and tirzepatide have different price points. And that comes from a couple of things. One is certainly availability just in the market. How hard is it to get that medication and how hard is it for them to make the medication for you? So tirzepatide tends to be slightly more expensive than semaglutide, but really it's an individualized decision with your provider to think about what medication is going to be the best fit for you. I will say we have lots and lots of patients that do incredibly well on semaglutide, love it, and really have no reason to switch. And then I have lots of patients that are on tirzepatide and think that they would never take semaglutide. So it really is individualized.